disease transmission. Transmission of disease. Disease transmission is the transfer of infectious agent from an infected host to an uninfected host. So that is a primary definition of maybe a transmission of disease. But if you like, you can make it a little bit more complex by saying transmission of disease is the transfer of infectious agent from infected host to a susceptible individual host and then to another host, a susceptible individual host. So you find out you have transmission of disease either from the reservoir to the susceptible individual host or from one infected host to another susceptible individual host. So this issue of transmission of disease causing agent occur either vertically or horizontally. And you see, vertically is telling you from parent to offspring, from parent to the children, is something that is genetically constituted. Either you get it through birth, from parent to offspring, you get a birth, you get the disease from mother to the offspring, that you can be able to get vertically. But transmission horizontally is from one infected individual to another individual, or from the reservoir to the infected individual. Something that after giving birth, whatever you contracted is called horizontal transmission of disease. If you can be able to transmit the disease after birth to another susceptible host, then is what we call vertical transmission. Horizontal transmission. So this issue of vertical is clear now. Just anything transmitted from parent to offspring or from mother to the offspring, maybe during birth, the process of birth, a child maybe contracted the disease from his mother to the world. Now he has contracted that disease through vertical transmission. But any other transmission after birth is what we call horizontal transmission of disease. So this horizontal transmission of disease, we have what we call direct and indirect. It is divided into two from the beginning. We say direct transmission and indirect transmission. A direct is something that is what we call no involvement of any intermediary. That is direct. Like direct are divided into up to four, whereby I have transmission by contact, transmission by inhalation, transmission by ingestion, transmission by injection. So you find out all these are what we call direct transmission without any involvement of intermediary. So you find out transmission by contact. Example, most of the venereal disease, sexually transmitted diseases, is a contagious bovine pleuropneumonia, dermatomycosis. Dermatomycosis is most of the fungal diseases that are acquired when you share a t-shirt or like footballers who are sharing t-shirt, you find out you can contact, or you share cum or something like that. So anything by contact, most of the sexually transmitted diseases, you find out all this STD is through contact. You have to contact, then you get the disease. Then number two, we have transmission by inhalation. Most of these rinderfest, canine distemper, pestis, dispersed ruminant, coronaviruses, and so many other things are example of something you inhale. You inhale a droplet size, which every disease, they have what we call droplet size. So the droplet will continue to, for example, when you sneeze, or when you cough out some of the particles of your saliva will come out in droplets, but after they travel in air, they will begin to reduce in size. So there is what you call particle size of the droplet must be having a particular size before, maybe like 5 micron and above. before they can be able to cause disease. But it make you various disease causing organism has its own macron droplet sizes for them to be able to initiate an infection. But the more they travel in air, the more they are reduced in size. So we have what we call transmission by ingestion. You something eat fecal oral route. Something you contaminate your hand, then you come and contaminate the food, then you put it in your mouth. From mouth to fecal contamination. You see, all these are what we call most of the enteric diseases like salmonellosis, coccidiosis, rotaviruses, and so many other disease-causing organisms that are of the fecal oral route that you now contaminate your hand. That is why it's not good for you when you are cooking food to go and to go to toilet and come back. Probably you go and piss or you go and spoil your hand contamination. Then there are more chances of you to contaminate the food. So it's better when you want to prepare food, you prepare yourself very well so that when you begin the process, you don't have to cut and go and do something. Sometimes you see people are selling food in the roadside. You find out they will do asham, and then they will do like this on the hand, and then do like this in their bodies, and then they will continue what they are doing. That also they are causing contamination. They cause organisms that are of the nasal swab, nasal conjunctivitis, and then they will now come and contaminate the food, and then from there you put it in your mouth. So actually, people that are supposed to sell food, they're supposed to be dressing very well. Not say you dress anyhow, your hair is outside your body, everything, but you dress fine so that you can be able to not contaminate the food people are eating. That is very important for our healthcare association, healthcare management to be able to look at the sanity and hygienic condition of somebody who is selling the food, and also the environment he is selling. Some people will be selling food, but the environment is very dirty. You have to take care of the environment where you are selling food. Then the last one is transmission by injection or bite. Mosquito bite is an injection. Mosquito bite you, or through injection, when you can be able to inject yourself or you doctor inject you. Sometimes the syringe may be contaminated, and you have to care must be taken. Sometimes you touch the syringe with your hand, with your bare hand, needle hand. You are now contaminating the syringe, and from there you go and do the syringe to individual. And sometimes you see insect bite. It's like it's an injection. You have injected something. So mosquito use his proboscis to insert the proboscis into the body and withdraw blood. He's doing also injection. So many diseases can be transmitted by injection, by bite. Then that is for direct transmission. The other one I mentioned is indirect transmission. Here, indirect, there is what we call involvement of a intermediary between that involved in the transmission of disease. Indirectly, involvement of intermediary, either a vehicle or a vector. The intermediary here is either a vehicle or a vector. Here, a vector is a living organism that is transferring the disease-causing organism to another susceptible host, while a vehicle is an inanimate object like a bureau, like just bureau like this, a biro like this can be able to be a vehicle of a disease. It can be able to transfer disease from where it is, from one person to another person, or from one environment to another environment. For example, those who has the habit of putting the virus in their mouth, you find out they are transferring the organism. So here the transfer, it involves an intermediate that is a vehicle. A vehicle is something that is inanimate, something that is not a living organism, while a vector is a living organism. So transmission by a vehicle here is an inanimate transfer of disease using agent from infected host to a non-infected host. So transmission of shigellosis, transmission of human cholera, and so many other things can be done through a vehicle, to have a transmission from vehicle. For example, some of the vehicle here, we have air. Air is an example of vehicle, milk, soil, and fomites. Fomites like items, like a barrel, like clothes, like knife, and so many other things. These are somites. So you find out is what we call indirect transmission, but through a vehicle, through that something that is not living organism, something that is not living organism, like air transmission from foot and mouth disease, Newcastle disease is transmitted through air, coronavirus, and so many other things. While we have milk, organisms that can be transmitted with milk, like brucellosis and other contamination of the milk during milking. It can be contaminated with the udder of the animal, for example, cow, or maybe animal dog will enter, and from there infection will occur, like fever, tuberculosis, salmonellosis, and so many other things. So you find out milk has to be very clean. Has to when you are milking your cow, try to wash the udder before you start milking. Wash your hand properly also, or may use hand gloves. And also wash the udder very well. Wash the udder, the area also, and find a very clean area. Don't go inside the sheet where they are shitting, where they are used to give heat, and then you just start milking there. Find a very good environment. And another indirect transmission is transmission using vehicle as a soil. Soil is also a transmission, like Clostridium tetani. Then we have fomites. All these knife in the kitchen utensils, the pot we use to cook our food, the cup we take water, the plate, anything not living, those are constitute what we call fomites, object such as knife, clothes, rag that we use to clean our house, forts, and so much on. All these are what we call fomites. So we have transmission that is indirectly by what we call a vector. And you know, vector, I told you, is a animate transmitter of disease causing agent from infected host to susceptible host vector. Susceptible host vector transmission could be mechanical or biological. You see, vector transmission, you see everything, this thing is divided into two. So like we see indirect, we have indirect transmission either with vehicle or a vector. So now the vector itself is now divided into two, either mechanical vector transmission and biological vector transmission. So when we say mechanical vector transmission, for example, when you say vector transmission of disease-causing organism by animal that is living organism. So, for example, cockroach can go to toilet, and from there it can transmit disease-causing organism to a susceptible host. Maybe to the food we eat, then we eat the food, then we now get the infection. So you find out a vector, mechanical vector transmission is like the vector took the infectious organism in the body of the vector, for example, in the legs and mouth part of mosquito, in the leg or mouth part of housefly, or in the legs and wings of cockroach. So it's like it's now carrying out the infectious organism in its leg or in the body part of it, and thereby now transmitting the disease. So in mechanical vector transmission, it's like between the infectious agent where the organisms get the contaminated agent. So to the place where it will now go and cause the infection must be very near. If it's very far, for example, housefly is now living in our duplicate in our waste metabolite of the body, like feces or the fecal matter. So you find the fecal matter of human have been associated with the house fly. So if the house fly is associated, so it's like you have to clean your house so that, because if you didn't clean your house, you are now making the chances of contamination very, very close. But if the contaminant are far away, for the flies to fly to your house to come and cause you to have a disease, the chances are very much reduced, because he will now be infected, will now be associated that mechanical transmission, mechanical vector transmission. Maybe the bacteria or the salmonella is on the legs or the body part. So before you know, the body wing has moved like this, and then it has already shed the agent. And then if it carried 1,000, it has now reduced to maybe 10. So you are now reducing the number of lot to be contaminated. If it's fly, he has already jumped from one place to another place to another place. Thereby, you see, he has now reduced the microbial load. Thereby, at the end, subsequent of getting infection, if the contaminants are very far away, so the contaminant must be nearby, so that the mechanical vector transmission can be able to take place. But that is why we said people should clean this environment, so that you don't have maybe adjacent or nearby disease causing association. While in biological vector transmission, the agent undergo some changes while in the vector. So you find out in vector transmission,